In California, Humboldt County has been the center of a sustained opioid crisis. At one point, data shows that Humboldt County had among the highest rates of opioid-related deaths and overdoses over any other county in the state. The origins of this unfortunate epidemic is actively being disputed by pharmaceutical company owners, the Sackler family, and California Attorney General Javier Becerra. The Sackler family owns Purdue Pharma, a pharmaceutical giant who invented and currently produces a controversial opioid known as OxyContin. Where the issue begins between these two conflicting parties is determining the origin of this epidemic. Javier Becerra argues that the observed opioid epidemic in California was started and sustained by the alleged deceptive marketing of OxyContin. The Sacklers, however, strongly refute this argument and insist that their marketing of OxyContin was in no way a deliberate scheme to hook people to their opioid for profit. Becerra has the interest of bringing Purdue Pharma and the Sacklers to justice for allegedly instigating an epidemic for the sake of profit via misleading marketing. The Sacklers, on the other hand, have the interest of disproving these allegations for the sake of preserving the reputation of their family name and company. The privately held company Purdue Pharma was founded in the year 1892 by John Purdue Gray and George Frederick Bingham. At some point in time, the company was then co-owned by brothers Mortimer and Raymond Sackler, both of whom are entrepreneurs and accredited doctors. Over time, descendants of these two have gone on to principally own and/or hold significant roles of power in the company. A notable figure of the Sackler family who has been vocal in this issue in California is Richard Sackler. In the year 1996, the source of this ongoing issue, OxyContin, was invented and introduced to the public by Purdue Pharma. Just as the image depicts, OxyContin was presented to the public in a non-threatening manner. To the average person, the pill bottle in which OxyContin was packaged appeared like any over-the-counter medication which didn't require a prescription. This is what is said to have caused the current observed opioid epidemic in places like Humboldt County. When introduced to the public, OxyContin lacked having any noticeable warning labels on the bottle. Furthermore, in early OxyContin ads, the drug was clearly advertised as a drug which cured the average knee or back pain. These ads presented OxyContin as a pain drug which was easy to manage and dose. These ads are what many consumers trusted in prior to there being any reviews on the drug. OxyContin was presented to the public as a safe pain drug which appealed to many due to its advertised fast-acting and long-lasting pain relief. What these ads failed to convey in hindsight is the strong potency and addictiveness of these pills. California officials wouldn't start to notice the opioid crisis until the 2010s when Humboldt County began to possess among the highest rates of opioid addiction and near death in the entire state. As shown by the bar graph, over the span of 4 years, Humboldt County had a significant amount of opioid-related deaths over the entire state of California. Specifically, in 2014, the data mirrors the increased severity and prominence of opioid-induced deaths in the county. Additionally, opioid-induced hospital visits remain at a constant high level in comparison to the state levels. This data is what began to spark interest in the opioid crisis, and the problem at that time was trying to identify the main source of this health crisis. With the opioid crisis showing no signs of stopping, Humboldt County began to embark on a mission to identify who or what began the state of crisis. In the year of 2018, Humboldt County officials began to cite Purdue Pharma as creators of this man-made epidemic. In the 2018 lawsuit, Humboldt County formally accused Purdue Pharma of intentionally downplaying the dangers of OxyContin through aggressive marketing, which claimed that it would safely cure chronic pain. Furthermore, the lawsuit went on to reveal that Purdue Pharma paid for quote-unquote signs to support their claims that OxyContin was an effective pain-relieving opioid to be consumed safely by patients. Also, with the help of data collected by the Drug Enforcement Agency, it was found that in the years of 2006 to 2014, Purdue Pharma was the fourth most prominent opioid manufacturer in Humboldt. However, it's to be noted that Purdue Pharma was the #1 privately owned drug manufacturer with a presence in Humboldt. 2018 was the year where the Sacklers and their company began to be associated with being the creators of the opioid crisis in Humboldt. A year later, in 2019, Javier Becerra entered the dispute with the hopes of fulfilling his role as Attorney General. For context, Becerra earned his degree in economics from Stanford University and his Juris Doctorate degree from Stanford Law School. Following that, Becerra was elected into Congress to represent the downtown Los Angeles district in the House of Representatives in 1994. Since then, he's had ever-evolving roles in Congress. He then was elected the Attorney General of California in 2017. With this newly adopted role, Becerra entered into the opioid issue by filing a lawsuit against Purdue Pharma and the Sacklers for allegedly creating and sustaining the opioid crisis. Just like the Humboldt County lawsuit of the year prior, Becerra adopted the arguments that the Sacklers knowingly allowed Purdue Pharma to produce misleading marketing in order to attract more potential consumers. Becerra added more depth to this stance by revealing that Purdue Pharma sales representatives told doctors, patients, and their families that OxyContin was not addictive or subject to withdrawal symptoms and had less potential for abuse and addiction. These revelations further garnered support for his stance that the Sacklers knowingly allowed their company to deceive consumers into thinking OxyContin was a harmless opioid drug. Purdue Pharma's marketing of OxyContin became the source of much speculation due to there being a lack of transparency regarding OxyContin. Examples of questionable ads including ones which listed the numerous benefits of OxyContin in the assertion that it was both effective and acceptable. Furthermore, the idea that OxyContin was safe and effective was further driven by including the quote of a doctor who assured these claims. The image is effective in encompassing the argument that Purdue Pharma was never transparent about possible side effects, like is common in prescription medications. Additionally, Purdue Pharma has been accused of using altered scientific data in order to convey the long-lasting pain relief of OxyContin. In a graph which was created and circulated by Purdue Pharma, it illustrated that OxyContin almost immediately began having its pain-relieving results on a patient. Furthermore, the graph then goes to show how the level of effectiveness is maintained over a 12-hour interval, like is advertised. However, in an independently created graph created off accurate scientific research, it was discovered that while OxyContin does immediately go into effect, the pain-relieving qualities of the drug wears off rather quickly. In other words, OxyContin didn't last the 12 hours which were advertised, and these shortcomings then led to abuse because patients took more than they actually needed in order to attain those expected pain-relieving results. The allegations brought forward by Javier Becerra instigated questioning into whether the Sackler family deliberately downplayed the negative known attributes of OxyContin.
Purdue and the Sacklers traded the health and well-being of Californians for profit and created an unprecedented national public health crisis in the process. But we will hold them accountable. That's why today I am announcing a lawsuit against Purdue Pharma, certain of its affiliates, and former officer and board member Dr. Richard S. Sackler for, as we allege, engaging in unlawful practices in the marketing, sale, and distribution of opioids. Our complaint alleges that Purdue Pharma knew as early as the 1990s that one of their drugs, OxyContin, was among the most abused opioids in the country. What was their reaction? Well, they doubled the size of their sales force the following years.
In the words of Becerra, the Sacklers had knowledge that OxyContin was creating a cycle of abuse and nothing was done to address the issue. The cycle of abuse is detailed in an infographic which supports Becerra's claim.
When doctors complain that OxyContin doesn't last 12 hours, the manufacturer, Purdue Pharma, tells them to prescribe stronger doses, not more frequent ones. Raising the strength results in higher highs and lower lows, experts say. This may extend the drug's duration, but it doesn't guarantee 12 hours of relief.
In the wake of these allegations, the Sackler family continuously denied any wrongdoing by citing how their company operated on values which reflected wholesome intentions to safely address the needs of patients. It has been observed that Purdue Pharma has changed their advertisement in order to reflect that they're conscious of the opioid issue. With this newly found focus on acknowledging the opioid epidemic, Purdue Pharma has shown that they are committed to helping alleviate the issue. While it isn't explicitly stated, Purdue Pharma's shift in advertisement focus may be a direct response to diverting allegations of deceptive marketing. Despite the Sackler family claiming not to have conducted any immoral behavior, past records demonstrate Purdue Pharma continuing to repeat offenses which they deny committing. In 2007, Howard R. Udell, the top lawyer for Purdue Pharma, Dr. Paul D. Goldenheim, Purdue Pharma's former medical director, and Michael Friedman, the president of Purdue Pharma, were found guilty of misleading marketing. In the case, they pleaded guilty to misbranding, which goes against their claim that they were unaware of misleading marketing in previous and future statements, in response to allegations of people who share the same interests as Becerra. Just like Becerra claimed, as early as the late 1990s, OxyContin began to be mislabeled. By 2004, the FDA warned Purdue to rectify the issue. However, as seen in 2002 and even into 2003, Purdue Pharma tried to find loopholes around these requests in order to continue making OxyContin appear harmless. This demonstrated that Purdue continued to disregard warnings to stop conducting misleading marketing which they were made aware of. While the opioid epidemic has seen an ease in prominence in Humboldt due to more awareness being brought to the issue, It is undeniable that whether it was intentional or not, the Sacklers had misleading elements in their marketing. After the FDA cracked down on regulations which seek to rectify Purdue Pharma's dishonest marketing, yearly sales began to decline. What this shows is that Purdue Pharma profited from the misleading marketing. While OxyContin may have still been successful if marketed in a truthful manner, it is clear that most sales were driven by selling consumers on a false promise. Once more speculation started to rise about Purdue's marketing tactics, sales declined. Prior to conducting this research, I was an unbiased and uninformed individual in this heated debate and controversial issue. However, after looking at data and court documents, it is clear that Purdue Pharma and the Sacklers disregarded any information which confirmed that OxyContin was being abused due to their misleading advertisements.